Hello, ladies and gentlemen, and welcome to Memory, a review for criminal justice, forensic mental health, and legal professionals. My name is Darian, and I'm the Executive Manager with the American Institute for the Advancement of Forensic Studies. We commonly use the acronym APHIS, which you may have previously heard. I'm so pleased to be with you today and to have the opportunity to introduce our guest presenter, Jared Brown. He's a real standout in the field of forensic mental health and has a great understanding of memory. Jared has made remarkable strides in expanding education within the areas of forensic mental health. He's also written several articles, which can be accessed online completely free at Forensic Scholars Today. He's currently the treatment director at Pathways Counseling Center Incorporated, located in St. Paul, Minnesota, and is the founder and chief executive officer of the American Institute for the Advancement of Forensic Studies. Finally, he's just an all-around fascinating person, and we are truly in for a treat today. Without further ado, please join me in welcoming Jared Brown.
Thank you, Darian, for that kind introduction, and thank you everyone for taking the time out of your busy day to tune in to today's webinar presentation on memory, a review for criminal justice, forensic mental health, and legal professionals. Here's a copy of my biography. If you have any questions, thoughts, or concerns about today's webinar presentation, please don't hesitate to send me an email at the email address listed below on this slide. Here's today's training description. I would say memory and memory impairments are one of the most important and complex topics that criminal justice, forensic mental health, and legal professionals should know about, but in my experience have not had a great deal of exposure or training to this complex topic. And we're going to be talking about memory and memory deficits and have a discussion on false memories and misinformation and memory illusions and really what ramifications this has for all facets of the criminal justice and legal system. I have three primary objectives that I'm going to present today, and hopefully all of you will walk away with really a better understanding of some of the basic processes involved in memory, and also be able to identify and distinguish between the various common memory impairments and deficits. And we'll also have a discussion about some of the approaches and techniques that criminal justice and legal professionals can utilize to really help maybe detect when memory issues are at play and to help hopefully decrease some of its negative impacts on a defendant or a suspect or a witness. Today's agenda is broken up into 5 parts. We're first going to have a discussion on just the basics of memory and kind of get our heads around some of the key concepts, facts, stats, and statistics, and then move into having a direct discussion about the forensic and legal aspects of memory. And then I have a section on special topics of discussion. It's just a large array of subtopics that are intersected with the world of memory. And then we'll have a section on intervention and some treatment considerations, followed by a conclusion. At the end of today's PowerPoint, there's a number of supplemental slides that I will not have time to get to today, but I left them in today's presentation for all of you to have and be able to reference and utilize at your own disposal. So here's a background of my experience. Most of my experience has been working with adults with a number of mental health issues over the years. Many of my clients have had significant memory deficits and impairments. And when you're working with clients with mental health issues or brain injuries or trauma-related disorders or even learning disabilities and intellectual impairments, more times than not, they're going to have some issues involving memory, some more than others. As we move into the basics of memory, there's really 3 stages of memory that all of you should be aware of. And the first stage is encoding. And when I talk about encoding, really the consolidation of memory, the consolidation and encoding of sensory information from the world. And then there's a component called storage or maintenance or just the retention of memory over time. And then we move into retrieval. It's really how does someone recall that information and use it in everyday life? How do they recognize when they need to recall a memory? I think one of the biggest factors to consider when we talk about memory is the fact that it is a complex topic. It is a confusing topic. And in my opinion, it is one of the more important topics in the criminal justice or forensic world, because if you're dealing with someone that has memory deficits, getting accurate information from that person could be problematic. If you're dealing with a witness who has memory deficits, the integrity of that information being utilized in court can have significant ramifications. If you're a mental health professional doing diagnosing, developing treatment plans, and you're not taking into account their memory deficits, a lot of times it could lead to an inaccurate picture, snapshot, assessment of the individual that could lead to under or over or misdiagnosis. The biggest thing we always need to ask ourselves when we're working with someone is really, what is the person's overall memory capabilities, their capacity for remembering, and what type of memory deficits or disorders are they dealing with. Here's just a few more thoughts. When I think of memory can be a very mild deficit all the way to very severe. It can be progressive in nature, such as Alzheimer's or dementia, or it can be immediate from a blow to the head from a traumatic brain injury. Memory deficits can be short-term, or they can be very long-term. And the deficits can really be many and varied. In some cases, there could be lifelong memory deficits. Keep in mind, memory is really important for just the individual's own personal identity. It has significant implications, again, for the criminal justice system. It can have significant implications for just interpersonal and social functioning. And I would see memory deficits maybe falling along a spectrum as well, again, ranging from the mild to severe, but really everything in between. This is a quote that I come across frequently when I have prepared today's presentation, and I think it really is a great snapshot of the importance of writing things down and fact checking, because memory can be inaccurate. And this quote says, "The faintest ink is more powerful than the strongest memory." So it's important, don't just rely on the person's memory per se. And I'll stress this many times throughout today's training, is the fact that just because someone is very competent in their memory does not mean that it is an accurate memory. So competence does not always equal memory accuracy. This is another just, I think, important point to take into account, that despite confusing real and fictional events, false self-reports may hold some element of truth, which can create an impression of accurate reporting. So when someone mixes up an event that is real with an event that did not take place, there could be something that is called a source monitoring deficit that can take place. When we talk about false self-reports, this could be maybe better explained by the topic of confabulation. That's a topic that I present on often as well. And again, consider the impression that the person is giving off, especially a witness or someone giving testimony in court. They may give the impression that they are extremely confident and accurate in their memory, but what research and science tells us that might not always be the case, because again, memory can be distorted, it can be misinformed. If we talk about the topic of suggestibility, that's another variable to take into account when we talk about memory. These are some of the things that you will see if you go through the literature when we talk about memory. It's the fact that it can be altered, it can be contaminated, it can be fragile, it can be imperfect, it can be molded, and it can be unreliable. And again, consider the fact that memory can be extremely vulnerable depending on the situational variables, environmental and social variables. Consider interference. And when I talk about the topic of interference, what is interfering with that individual's ability to process and encode and retain their information in memory? Is there high amounts of stress going on? Are they dealing with sensory overload? Do they have concentration, learning, attention deficits? Are they under the influence of a controlled substance or alcohol. Those are all things that can interfere and create memory distortions, memory deficits. And again, consider the role of suggestion and really misleading information when we talk about memory capacity and memory deficits. There are a number of factors, conditions, and disorders that can impact memory. These are just a few of the ones that you'll find in the literature. Those of you that are in the criminal justice system, you're going to encounter people with traumatic brain injuries on a regular basis, including individuals with fetal alcohol spectrum disorder and post-traumatic stress disorder. These are all disorders that memory can be significantly impacted, so take that into account when you're working with any defendant or suspect that has these issues. A few other ones to keep in mind is Huntington's disease. That's another one that the memory is severely impacted, or if someone's recently had a stroke. Diabetes in some cases can cause memory impairments. Even clients that have high blood pressure issues. And again, chronic substance use can all impact one's memory. What are some of the consequences associated with memory? These are just things I have personally observed in some of the clients I've worked with. I just started writing down a list of all the things that I can remember working with clients over the years where they've had issues associated with memory problems. Lots of them have had academic limitations where they weren't properly identified in school. They were in special education. They've never had their memory truly tested and evaluated. Having memory issues can also lead to issues of anger. It can lead to a lot of issues of self-esteem and shame. Reasons being they might be looked upon as someone that might be lazy or forgetful or just doesn't take something serious. But if you look deeper, in some cases, it might be the direct result of having a memory impairment. So these are just some things to keep in mind. Again, they can be minor disruptions all the way up into life-threatening situations. And one example would be as someone leaving the stove on and forgetting about the stove or some fire safety considerations. There can also be issues of parenting where they forget the child in the bathtub. Those are all documented things that have happened to people as a result of memory deficits. So how can memory be impacted or lost? Again, age could be related to that, could be progressive in nature as someone gets older. Typically, their memory becomes somewhat slower as the aging process goes on. Have they ever had a brain injury? Even consider the fact that have they ever had a concussion or some other mild form of head injury? Chronic stress can really impact that. Depression. Divided attention is an interesting one. People that have memory issues that try to multitask, do 2 or 3 things at once, the more you divide the attention, the more difficult it will be for the person to remember and process and encode and retain that information over the long haul. Interestingly, if you're working with clients that have a long history of isolation and they don't have any social stimuli, they don't have friends, they don't have family, there's research to support the fact that some of these individuals may struggle with memory because they're just not using their memory. And chronic sleep deprivation. Getting good sleep is a protective factor against improving memory. Not having enough sleep can exacerbate memory problems and deficits. I think this is another good quote to point out is the fact that memory does not operate like a video recording. In fact, memory is a reconstruction of events rather than a reproduction. And when we talk about this, be aware of memory contamination and what can contaminate a person's memory. I've spoke about that in previous slides, but again, think of the situational variables, the environmental factors. Are they dealing with any untreated mental health issues? Is there a high amount of stress? Are they sleep deprived? Are they under the influence of drugs or alcohol? Are they in a situation where they're being pressed repeatedly to give a response to a question? All things to keep in mind. This is one of the most important topics, in my professional opinion, that criminal justice professionals should know about, including mental health professionals, is the topic of working memory. When I talk about working memory, think of it as somebody that is utilizing their memory. It's really a short-term memory component where It's almost like a drawing board or a blackboard or a sticky note where they're writing themselves reminders down in their mind that I need to do this. The working memory is very crucial in terms of organizing and keeping track of short-term memory issues or memory just in general. How does the person hold and assemble and manipulate and manage information and utilize that to solve problems and just deal with everyday life? Working memory is so important when people want to compare and contrast information. If people have issues in working memory, it can lead to issues in long-term memory storing. It could look like someone has poor listening skills. They really struggle with multi-step instructions. In some cases, they may really struggle with just navigational deficits. Those are all things to keep in mind. And a couple other things to keep in mind is if you're ever wondering if one of your clients has working memory issues, just ask yourself these few questions. Does the person seem to rarely make progress in any treatment goals or really anything that you say to them? Does the individual appear to lack motivation or direction? Does the defendant appear to be easily distracted in the courtroom? Does the individual ask or answer a question that does not match with the topic of hand? And does the person forget what they want to say repeatedly? If you have clients that fall into that bracket, it's possible they have working memory deficits. By no means does that explain everything, but if you suspected someone has memory deficits, particularly in this domain, it would be beneficial for you to refer out to a qualified mental health professional, a psychiatric professional, to have the individual properly evaluated, because if you can better understand their working memory, modifications can be made to really help that person be more successful in treatment or navigating their way through the complex criminal justice and legal process. Again, I spoke about this in detail earlier, but correlation between competence and accuracy is weak in terms of someone being very competent on the witness stand, that they 100% saw that individual do that crime. Again, research supports the fact that confidence is not always an indicator of memory accuracy. When we talk about specific types of memory, declarative memory is one that I want all of you to be aware of. This is also known as explicit memory. It's really known as fact memory. So the who, what, when, and where. It's really broken down even further into somatic memory, that's factual knowledge. An example of this would be is just remembering the basic colors or names of individuals or the various seasons. Then you have episodic memory, memories that are personal, that are more attached to a certain place and time. And then we talk about procedure memory. This is memory associated with how to do something. So routines, skills, things are automatic, motor actions. A couple examples of this would be is just getting dressed in the morning, just daily routines, operating an automobile, riding a bike. These are things once learned, they're just automatic. People just do them without thinking about it a lot of times. Getting dressed in the morning could be another example. When we talk about prospective memory, you think of it as delayed intentions or holding something in your memory, knowing that you have to do it in the future. Best way to look at this would be really a combination of working memory plus a sense of time equals prospective memory. Deficits in this area can lead to mistrust in the person's own memory. In some cases, it could lead to other people really perceiving the individuals being irresponsible or lazy. Another way to look at this, if you go through the literature on prospective memory, is some people refer to it as really remember to remember, forming intention in their mind and just holding it there and knowing they have to do something later on. A good example would be, when I get home, I know I have to feed the dog at 5 o'clock. That would be one small example of prospective memory. Again, when we talk about episodic memory, I've seen it referred to in the literature as really mental time travel, autobiographical memory, going back in time, remembering important dates, anniversaries, remembering the birth of your child, remembering when you got engaged, things like that. recalling a particular place, event, or different life experiences of importance, recalling a particular friend or person, recalling a particular time or date. And then flashbulb memories, I won't have time to get into that in great detail, but an example of a flashbulb memory would be really a high emotionally charged event. A couple examples that always come up in the literature would be the assassination of JFK, the attack on Pearl Harbor, 9/11. To break down autobiographical memory in just a little more detail, think of it as memory of self, really the who, what, where, when of self. These are, again, personal experiences. They can really help guide and inform decision making in some cases and regulation of behaviors. This TOM that I have on here, TOM, that's called theory of mind. You'll see this in the autism literature quite a bit. This is really being able to have good perspective taking, put yourself in other people's shoes, and being able to really understand the thoughts, the motivations, and intentions of others. When people have autobiographical memory deficits, they'll often have issues with theory of mind or regulating their behaviors in some cases, or difficulty with problem solving because they have a hard time utilizing past events and utilizing that information for current events, current problems, just current activities. We could spend a whole section or whole training just on amnesia, but I just want to have a couple slides on this just to introduce this topic to all of you. People that have amnesia, it can really impact just their day-to-day functioning. It can impact their ability to function independently. It has significant implications for the family system and the criminal justice system as a whole. Two main types of amnesia I'm going to talk about is interrogate amnesia. This is more really short-term amnesia. It's referred to as pathological or chronic forgetfulness. It can impact all stages of the criminal justice system. People with this type of amnesia often have difficulty remembering dates, times, places, spaces, and faces. They really have a trouble learning new skills. They have deficits in encoding of new skills and recalling of new memories. They may remember how to ride a bike from years ago, but they can't remember what they had for lunch the same day. Then we have retrograde amnesia. This is more long-term amnesia. You might see this if you're working with someone with Wernicke's-Korsakoff syndrome, where they lose access to memories from the past. And in some cases, it could be multiple decades ago where they've lost memories. More common was the first one. Less common is the second one, but it can both be common among certain individuals with certain deficits and disorders. Occasionally, you might come across post-traumatic amnesia. This might be a direct result of having a traumatic brain injury. This is very short term. It could last for seconds to minutes. In some cases, it could last for weeks or months, but that's more rare. They're more short term. When you have someone you suspect has post-traumatic amnesia, obviously having them consult with a medical doctor, getting the medical attention right away, but it's important to also rule out what variables and factors may be at play. Are they on drugs or alcohol? Are they withdrawing? Again, some red flag indicators would be just overall global confusion and disorientation, just really out of character behaviors, just memory issues where they didn't previously have those memory issues, and just really bizarre behaviors that could present verbally or even be acted out in a physical presentation. As we move into the forensic and legal aspects of memory, I think this really is a good reminder is memory is by definition fallible at best and unreliable at worst. These are some of the implications to take into account when we talk about memory impairment in the criminal justice system. By no means is this all of them, but this is a good snapshot of some of the things to keep in mind. If you are a defense counsel, consider the impact that memory will have on the defendant in really navigating their way through that complex trial process. If you're a probation officer, a treatment provider, if you have a client that's constantly forgetting to come to appointments after reminder, it might be important to have that person evaluated to see if there's any memory issues at play. If you're a law enforcement officer doing investigative interviews, consider the impact it has on the integrity of the information you're gathering from that individual. Cross-examination, eyewitness testimony, Miranda rights waiver, police lineups, all variables to keep in mind. If you're a competency to stand trial evaluator, very important to really look at how their memory impacts the defendant's ability to just be successful and competently navigate their way through the trial process and effectively assist counsel. If you're a probation officer, consider the impact on probation requirements and then court-ordered treatment. Another important reminder is the fact that investigative interviews and sworn testimony are likely to take place days, weeks, months, or even years after crimes occurred, making meaning-based memory distortions more likely. Consider memory confusion in this situation or memory contamination. When someone first witnesses an event, the longer that event goes by, the more memory contamination can occur. So an example of this is someone's witnessed an event with other people. Since that time, they've talked to people about it repeatedly. They've read news stories about it. They've been on social media and they keep thinking about it and they keep processing it, keep telling the story over and over again. A lot of times, by the time they reach court, their version of the event was significantly different than the first time they reported the event to law enforcement. Consider the impact of suggestibility and confabulation as well on this. If any of you are looking for a really good resource, I would recommend taking a look at this particular article. Those of you that are competency to stand trial evaluators or forensic evaluators or doing really any type of forensic evaluation, when we talk about memory deficits, is really ask yourself, what is their overall executive functioning capabilities? How do they plan? How do they reason? How do they problem solve? How do they multitask? How do they really just anticipate consequences, plan for the future? A lot of times when you're dealing with individuals that have memory deficits, they're also going to have issues of attention and comprehension. What's the individual's processing of speed abilities? Court's a fast-paced environment. Being interviewed in a law enforcement capacity can be a very quick environment. It's important to really rule out, does the person have any processing speed deficits? Slow down the pace of the interview if possible. What's their level of social judgment? Is the individual chronologically age 40, but they seem like they're acting as if they're a 12-year-old? Some things to ask yourself is, what is their developmental age rather than their chronological age? What's the individual's verbal and auditory memory capabilities? Is there any history of amnesia? And keep in mind, it can be difficult to assess when you're not using standardized tools and being able to review collateral sources of information or talking to other individuals who know the person well. And of course, you need to rule out malingering in any of these cases as well. A defendant's ability to comprehend and follow legal proceedings is dependent upon both attention and memory. And take it a step further, when we break down memory, again, it's dependent on their working memory, short-term and long-term memory, really all facets of their memory. If you're looking for any articles that indirectly talk about memory within the context of competency to stand trial, I would recommend checking out these 3 articles. When we talk about children's eyewitness testimony, I think it's really important to keep in mind that this is an area of research that continues to evolve. It's important for us to really stay current on the scientific literature as it relates to this topic. When we talk about children's eyewitness memory, I think it's even important to break down is the child fantasy prone. What's their level of suggestibility or their executive functioning capabilities? What's their overall cognitive or language abilities? Remember I talked about a few slides back about theory of mind. That's another important component when we talk about children's eyewitness memories. What's their theory of mind capabilities? Has the child been exposed to any trauma? Are they dealing with any post-traumatic stress disorder? Is the child chronically sleep deprived? Are they dealing with insomnia? What's the child's working memory? I think it's also important for forensic evaluators, child protection specialists, to rule out, does the child have any neurological or neurobehavioral, neurocognitive disorders or any type of serious mental health issues going on? And again, what's their attention, their learning, and their concentration abilities? And consider the passage of time. Again, how long was it from when they witnessed the event to when they have to share the event in court, and the issue of memory contamination and confabulation as well. In the criminal domain, loss of memory for crime details may indicate the possibility that the crime was unintentional, and in this way raises the issue of diminished responsibility. I think these are things just to keep in mind for defense counsel to take into account. This is a really good article too that I would recommend if you want to go deeper into really understanding the neuroscience of memory and its implications for the courtroom. A few other important reminders for legal professionals to keep in mind when we talk about memories: really fact check, verify, independent corroboration. Try to avoid any type of suggestive interviewing techniques. Limit the use of yes or no questioning as much as possible. Sometimes people with memory deficits will have the ability to mask their deficits by covering up with yes or no questions. So they'll give the indication by nodding their head that they understand, but if you fact check and verify and have them explain to you back in an open-ended question format, a lot of times they'll have no idea what they just agreed to. Try to utilize open-ended questioning more often. If you suspect memory issues are going on, consult with an expert that understands memory. Get some ideas, more suggestions on how to communicate and what ramifications this has for the person. And again, memory competence does not equal memory accuracy. As we move into special topics of discussion, we're going to move quickly through this, but it's important for us, I think, to have a basic discussion about the DRM paradigm, the misinformation paradigm. Consider what psychological vulnerabilities is the individual dealing with: neurological, again, language, executive functioning issues, any mental health issues, any learning problems. Again, I touched on this briefly, but source monitoring errors and autobiographical memory deficits. So the DRM paradigm is a research paradigm that shows how easy it is to elicit a false memory. This is a paradigm that was developed in 1959, but later expanded on by two other researchers in 1995. Hence, we have the DRM paradigm. The way this paradigm works is participants are exposed to a list of related words. It can be either verbally read to them, or they may have a sheet in front of them where they look at it and read it themselves. And the related words in this case would be all related to the word sleep. So we have awake, bed, blanket, doze, dream, and so on. So there's a list of 15 words. There's one missing word in there: sleep. And this is interesting and important. When participants then are asked to recall what they heard or what they saw on a sheet of paper, in a lot of cases, they will recall seeing or hearing the word sleep, even though it wasn't in there. So their memory kind of filled in that blank and just assumed that since all these other words are related to sleep, the word sleep was in that list. Hence, shows how easy it is to create a false memory. And any of you that want to learn more about this paradigm, if you just Google the DRM paradigm, there's a host of research articles out there on this. When we talk about false memory production, it can happen in the laboratory in controlled studies. Consider the impact again on the criminal justice and legal systems, and it really can have real world consequences. Consider family court as well. If there's child custody issues going on and one or both of the parents or one of the children has memory deficits and inaccurately reports something or believes something that happened in the past when in fact it didn't. Consider the impact of false memories just on everyday life and managing your daily affairs. And then consider suggestive influences. There's suggestive influences all around us. We all create false memories from time to time. We can all be suggestible. Consider the role media plays in this, and just being around certain people or social influences or people asking suggestive questions. Traumatic life experiences can be a variable to consider. And in some cases, consider therapeutic approaches that are utilized with certain clients that may be more likely to create a false memory. And in some cases, there's some research to show the fact that imagination exercises or guided imagery or dream interpretation or hypnosis can lead to false memory creations in some cases. Most people have probably heard of the misinformation effect, but just to tell you a little bit more about this, this was a research approach that was developed in the 1970s by Elizabeth Loftus and colleagues. And it really shows how easy it is for someone to have their original memory altered by post-event misinformation. It really looks at eyewitness memory and memory contamination and what social influences are at play when someone witnesses an event and then is later exposed to some form of misinformation and then changes their original story or comes to believe something that was not actually in the first demonstrated event. Consider the role of suggestive questionings and really consider just the type of wording or the language that an interviewer uses. Just changing the word the to or to the can really change the outcome of the memory. So another example would be too is look at the mood state the individual is in as well. Were they under a great deal of pressure? Were they in a group of people where they didn't necessarily believe their memory, but they're in a group of people that seem very confident in their memory? Maybe it was a group of people they know. There's some research to support the fact if you're witnessing an event and you're with a loved one or someone you know, you're more likely to adapt their version of the events than if you're with strangers. Lots of studies done on this. If you Google this, you can learn a little bit more and go deeper into this topic. Memory manipulation, I mean, it can happen in many variables. Again, we have the misinformation effect. Consider the role of suggestibility. I think it's always important to ask yourself when you're working with a client, do they have an overactive imagination? Do they seem fantasy prone? What happens if someone's using manipulated photographs or video evidence or manipulated advertisement? These are all things that can manipulate one's memory. And ask yourself this question too. If you have a client and they really struggle with memory or they've had really a long history of just being suggestible, gullible, and you know that there's a history of just the creation of false memories in this individual, really be aware of how you phrase questions. Use open-ended questions. It would be very important to consult with a memory expert at that point or someone that understands the topic of suggestibility and really get training on that to really craft your questions in a way that's not going to influence the individual. This is an interesting article that looked at false memories in food. I put it on this slide for all of you to take a look at another time, but this really looked at the impact of just creating a false memory in terms of changing attitudinal or behavioral changes in food preference and consumption. One way to create a false memory is to suggest false information. So remember the power of suggestion. Be very aware of how you craft questions, the phrases you use, and do everything in your power to limit suggesting someone, because we want to make sure information we're gathering from individuals is not suggestion in any way. And consider the long-term impact this can have for the individual, especially navigating their way through the criminal justice system. One other important reminder is the fact that true memories, false memories, and confabulation, delusions, lying, and malingering can be very difficult to decipher if one is going on or the other, because a lot of times they'll look all the same. Consider the powerful influence of imagination in thinking about a memory over and over again as well. That can create a false memory. And again, I think it's very important to remember that memory can often fail. I think this is an important reminder, is the fact regardless of someone's age, regardless of their education level or professional work experience, intelligent level, or just what kind of job they have, everyone is susceptible to false memories on some level. Now, certain age groups might be more suggestible than others. Individuals that are lower intellectual functioning may be more likely to elicit a false memory than someone that does not have a lower IQ score. but it can happen to anyone, and we probably all had a false memory at some point, and most of us have probably had many false memories. It can be minor distortions and just details of minor events all the way up into a creation of a false event that has extreme detail to it. Remember the fact when we talk about false memories, there's multiple reasons and variables why it happens. There's usually not one single reason. There's multiple mechanisms involved. False memories, this is another tricky thing to determine between is it a false memory or true memory, because the fact that false memories can seem very convincing. They can seem disturbing to the individual in some cases. They can have a dramatic reaction as a result of a false memory. They can have an emotional reaction. It can seem very vivid and real and scary. And they can be a minor incident all the way to a severe incident, everything in between. It's also important to take into account the issues of detection difficulties, and keeping in mind that some false memories might not be completely false. They might be a blend of the truth. There might be some element of truth in there. Maybe they got the event mixed up because of dates and times where they think the memory happened to them yesterday, later to find out it happened 20 years ago. And consider the impact of confabulation in these cases as well. When we talk about source monitoring errors, this is a good list just to keep in mind, but consider it more source confusion, blending episodes with one another. Can they determine between reality and fantasy? Did they see it on TV or did they witness it directly? Some people with source monitoring issues have struggles in those areas. People with strong working memories and are probably more likely to not have source monitoring errors than someone that has issues in working memory. Consider the impact of source monitoring errors on the legal system if it's a witness and they get events mixed up. And be aware of familiarity. I think this is one of the biggest takeaway points on this slide, is the fact that memories that are very familiar to one another, it's very difficult for some people to decipher between the two. So work with those individuals, make sure you have a good understanding of this topic. Again, related events, something that has a similar meaning, can be more difficult to decipher between events that are inconsistent or not related or just have meaningless versions of them. When you're working with anyone, particularly children, I think it's important to take into account their language abilities as well, or their social cognitive deficits. What are their overall vulnerabilities in their language? Some research indicates that strong narrative abilities may lead to better memory intention or retention, but on the flip side, in some cases, children or adults that have extremely high levels of narrative abilities and are able to tell elaborate stories, they may be more likely to confabulate as well. Consider the impact it has on memory recall, and just try to determine what their education and reading level is, or overall vocabulary abilities. And I think it's important to also rule out any history of traumatic brain injury or any type of adverse life event can have a negative impact on their verbal abilities and as it relates to memory retention. Another syndrome I think it's important to talk about is memory distrust syndrome. This is when someone really doubts their memory. They don't trust their own memory. They often rely on external cues to be able to answer and respond to the question. A lot of times they lack the confidence in their own abilities. This syndrome is not in the DSM-5, but it was coined by Johnson and McKeith in 1982. I'd recommend reading anything written by Johnson and colleagues. He's done a lot of work in the area of suggestibility, has some articles on confabulation as well. A lot of cases when people struggle with memory distrust syndrome as well, they can feel very embarrassed. They may feel inadequate. Consider the impact of alcohol or drugs as well, or anxiety or obsessive compulsive disorder or self-esteem issues. These are all variables that can maybe lead to increases in memory distrust. And it really can lead to overall credibility issues if it's a witness, if it's an employee, if it's a friend, if they don't trust their memory, in some cases it can definitely lead to them dealing with those self-esteem issues or embarrassment, or just it may lead to shame as well and other issues of depression. This is a very good article I'd recommend reading, came out last year. And this is another good article, came out in 2014 as it relates to this topic. When we talk about memory conformity, is look at it from the standpoint of, is the individual altered by some form of social feedback? Are they altered by social influences? Do they look to other people to answer questions for them? When we talk about witnessing an event in a group setting, I think this is where it comes into play a lot. I think it's important to really ask yourself, really, what social influences are at play that are leading this individual to go along with the group? Do they not want to be left out? Do they want to be liked by the group? Do they struggle with low self-esteem? Consider group size as well. In some cases, it can lead to source monitoring deficits. It can lead to false memories. It can lead to gaps in memories, which can lead to confabulation. It has significant ramifications for the criminal justice system, and it can lead to overall memory contamination as well. When the person witnesses the event, they have their own interpretation, but then they go along with what the group says, and their memories for the event changes. It can be very problematic for when these people provide information to the court about a witnessed event. 3 really good articles I'd recommend taking a look as it relates to memory conformity. And as we move into this last section, I'm just going to give you some tips, strategies, and solutions to take into account. Is if you're dealing with individuals that have memory impairments, it's very important to really look at getting interventions as soon as possible. Early identification is most beneficial. Symptom management as well. Is there any other different disorders going on? Are they dealing with sleep issues? Are they dealing with untreated mental health issues? Are they dealing with substance use issues? Treat all of those areas if possible. Get them referred to a qualified mental health professional. Maybe they need to consult with a psychiatrist for medication options as well. Get them plenty of rest. Encourage them to get rest and relaxation, particularly as someone that's had a traumatic brain injury. That's one of the best things you can do after a brain injury, is have plenty of rest. By treating all those secondary issues, in some cases the memory deficits may be improved. I think it's also important to educate the client about their memory, and also educate the caregivers, and I'd take it a step further, making sure that the professionals really have a good working knowledge of memory deficits in relationship to their client. So a few things that I've found that's been helpful working with people with severe and mild memory deficits is really to allow extra time for the individual to process information. Slow down the pace of the interview or the session. Try to avoid overwhelming the individual. Someone that has poor memory, stress is not a good thing for that. Be okay with long pauses and silence as well. I have a client that I've worked with in the past that I'll ask a question to, and it'll take her 10 to 15 seconds to respond. After knowing this individual, I know that she struggles with processing ability. Sometimes I need to ask the question in a different way. As a professional, just really try to stay calm. Don't rush the individual. Utilize encouraging approaches. Frequently check for comprehension as well. Just keep things simple and use developmentally sensitive approaches in language. And again, a good example of that would be is you have a defendant who's 40 years old chronologically. Maybe they function as a 15-year-old. You need to adapt the way you talk to them, the phrases you use, the vocabulary. A few other things to keep in mind is, again, avoid confrontation. Keep that stress down. Lower that anxiety level. Lower that worry or fear in the individual you're working with. In some cases, you'll be working with someone and they'll have no insight into their memory impairments. They'll have no clue that they have any memory issues. Try to encourage them to utilize a diary or some sort of memory diary or log to take notes. Teach them ways to be more efficient with monitoring their memory. Utilize positive reinforcements, empathy, and validation as much as possible. That's self-monitoring training. Teaching them how to monitor their symptoms really is a critical component of self-regulation and executive functioning issues. And again, treat those associated symptoms. if you're a legal professional, these would be all wonderful things that you could refer your client to a qualified mental health professional, and they would help work with the individual on these areas. Couple key reminders is be consistent, concrete as possible. Some of these approaches may need to be done long-term. Use developmentally appropriate approaches. Repetition is key in these cases. Another area that we won't have a lot of time to talk about is errorless learning. Really, this is a really interesting concept. These are a couple articles I'd recommend taking a look at. But what is errorless learning? I'm asked that frequently. Is really only allows the individual to answer the response to a question correctly. So it makes it almost impossible for them to answer the question incorrectly. It's used to target specific skills in individuals. It's positive reinforcement, and it's consistently used to achieve a particular desired outcome. And this approach is really typically used multiple times over and over again until the individual knows the skill to use. A couple other intervention considerations to take into account is looking at memory rehabilitation in general. What does that really mean? That could be meaning repeating things, being very proactive, teaching things that they can practice over and over again, modeling, coaching, coming from that rehabilitation standpoint. The design of their environment may need to be modified somewhat as well. And it's important, I think, to keep in mind too is really what domains of their memory are most impacted. And these are all things that would go hand in hand with the screening and assessment recommendations where they recommend the interventions as well. Again, what environmental adaptations really need to take place? Is there any external memory aids that are available for this individual? And in some cases, again, you're going to need to refer the individual to mental health care, drug and alcohol treatment, maybe sleep improvement strategies, and the family education and support piece are critical. These are a couple of the memory aids and memory rehabilitation techniques that you might want to consider looking at. The NeuroPage system is a pager system that provides the individual with reminders. All of these other ones are pretty self-explanatory, but keep in mind, take small steps with the individual. Try not to get frustrated and look for those small accomplishments. This is a very good article I'd recommend reading that talks specifically about memory interventions in the criminal justice system. Those of you that want to learn about procedural learning, I spoke briefly earlier about procedural memory, but this involves repeated performance and practice with the individual. And it's really important when you're helping the individual develop motor skills and improving their motor skill development. So as we wrap up today's discussion on memory in the criminal justice system, again, it's a complex topic. It's really multifaceted. This is just a small snapshot of a very large topic. It can be very confusing at times. I encourage all of you that work in these fields to seek out additional training, consultation, awareness, and stay current on the research literature. There's research findings coming out all the time about these various topics. And again, if any of you have any questions, thoughts, or concerns about today's webinar presentation, feel free to reach out to me at the contact information listed on this slide. Thank you again, everyone, for your time today.
Thank you, ladies and gentlemen, for watching our webinar presentation today. Also, a warm thank you to our presenter, Jared Brown, for a wonderfully informative presentation. For more information on APHIS and to see upcoming and available webinars, please visit our website. You can find the link in the description below. As a thank you for being a professional friend of APHIS, we also wanted to give you additional resources. We are including a link in the description below to access free online articles through Forensic Scholars Today. We also want you to have the opportunity to be the best version of yourself by furthering your education in earning a Master of Arts degree in Human Services with an emphasis in forensic behavioral health. APHIS has proudly partnered with Concordia University St. Paul to bring you an 18-month, fully online master's degree. For those of you who already have a graduate degree, you can earn a Forensic Behavioral Health graduate certificate in as little as 8 months. Direct links to this program are included in the description below. Once again, thank you so much for watching. Have a fantastic day.